and welcome to Rising Voices. We are putting on a special talk tonight with this lovely panel, one who is kind of missing from the screen. She'll be back. Oh, there she is. Thank you. This is a wonderful, wonderful opportunity to have this conversation from BIPOC women, or AFAB, who identify as females, and we're very excited to hear their stories. Before we get started, I do want to thank our sponsors for this panel this evening, starting with the Step Ahead Tri-Cities, Rise Healthy for Life and their collective impact, and Women's Resource Center at ETSU, and the Tennessee Coalition to End Domestic and Sexual Violence. So thank you all for sponsoring this panel this evening. Also want to make mention, I will make mention of it now and towards the end, that April 17th, which is next Saturday at the same time, 6:30, there will be a workshop, which a continuance of this conversation, hopefully to turn tonight's ideas and thoughts into actionable steps for allies and those who want to learn more about what this is. It is free to register, and you can do that at risehealthlife.betterworld.org. So also that workshop is going to be put on by Cindy Huss, and she is one of the heads at Rise Healthy for Life, and Chloe McMurray, who is works very closely and helps direct with the Tennessee Coalition to End Domestic and Sexual Violence. So, all that said, I want to go ahead and get into it. My name is Kaya Hudgens Smith. I am a board member with A Step Ahead Tri-Cities. I also work as a psychotherapist in this area for the Journey Center for Healing Arts. So I am thrilled to be here, and now I'm going to let these lovely ladies in front of me introduce themselves. And if you all wouldn't mind, if you can introduce yourself, anything you'd like to add as far as what brought you here and why you're here. Go ahead and start with that, and feel free, anybody, go. I'm not picking you out because I think that's rude.
There, I'll go. I'll volunteer as tribute. My name's Courtney Murphy. I live here locally in Johnson City and have been in the Tri-Cities since 2002. I came for college, and now Johnson City's where it's at. I'm a nurse practitioner locally in a healthcare organization, and I'm so happy to be here to try to help provide some education and some awareness. And thank you for inviting me.
Thank you so much, Courtney, for being here. I appreciate you. Who would like to go next?
I can go. My name is Brianda Conley. I recently finished my master's at ETSU in college counseling and student affairs, and a concentration in clinical mental health. I'm now at UT working on my doctorate degree in counselor education. I think I heard about this post from a past professor at ETSU, or a friend tagged me in it, one of the two. And I thought it was really important for our voices to be heard. I've had many experiences here. I was born and raised in Johnson City, and I think it's really important that our experiences are shared so we can better them.
Absolutely.
Yes, I can go next.
Thank you, Gracie.
So my name is Gracie Carter. I am from Johnson City. I've only ever lived one other place for a year and a half while my dad did his coursework for his doctoral degree. I also, like Kaya, sit on the board of directors for A Step Ahead, and I am working to earn my BSW from ETSU, which will hopefully be followed up by MSW and then a PhD in social work. And I'm just really excited to keep opening up the conversation because I think it's really important, especially in a rural, I cannot say that word, area like East Tennessee and Johnson City, especially, where we're at.
It is a hard word, rural. We don't use it enough. It's a hard word. Yeah.
You would think somebody that goes to college could pronounce that word, but I'm out for the count.
I'll go next because you just said you want to be a social worker, so go you. My name is Ashley Stewart. I'm a local social worker, local ETSU graduate with the VSW and MSW program. So if that's your aspirations, please call me. But I got invited here by a close friend, and I'll be sharing a lot about my dad's story and any other kind of stories that may relate to tonight's topic. I've lived in Tennessee since 7th grade, but originally from New Jersey. So if I talk fast, Kaya just say, hey, Ashley, slow down. I won't be insulted. I get that feedback a lot.
My whole family's from Jersey. You good? Like we fine. We fine. We gonna slow down. I ain't gonna slow down your hustle. You talk exactly how you need to. Also want to give a special shout out to Maggie Wood, who also sits on the board of directors with us for A Step Ahead Tri-Cities, who has worked very closely with Gracie and I in helping put this all together. So big thank you and so much gratitude for her as well. So y'all ready? Let's get into some questions. Also, participants, as you're watching, if you do have questions that come up that you would like to hear more from any of our panelists about, there should be a question and answer or chat function. Feel free to shoot your questions there. I'll be checking in with those as we go along, and hopefully we can get to your questions. Please don't be offended if we don't. We got a lot of questions to cover, but please, 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 I invite you, I encourage you, ask questions. There are no wrong questions. They're just answers that we haven't heard yet. Okay. So with that being said, let's get into some questions from my beautiful panel. Okay. Let's start with number one. What is one thing that has made you feel more welcome and accepted when seeking or receiving health care?
So I'll start again. Something that made me feel more welcomed and made me feel, I won't even say welcomed, I'll just say safe. I felt safe with my OBGYN I chose when I was pregnant 6 years ago. And just, I knew him a little bit before. I won't disclose who he is unless I can. I don't care to tell who he is. He's amazing. But just going in and our very first visit, and this guy's very well educated and also very well researched. He is very abreast to current documentation and current research and just up to date on evidence-based practice. And I felt very safe when our initial re-meeting of each other with my baby inside of my belly, that he acknowledged my skin color and what that meant for me being pregnant. I was aware statistically what that meant for me, hoping and praying that none of those bad things would happen, but running down the list, they did happen. So I was very safe in his hands and know that I'm talking to you today because he was aware of what could have happened and what did happen. And my son is alive because he was aware statistically of just what could have been and what did transpire with my pregnancy and delivery. Yeah. So just his knowledge and his acknowledgement of the bad.
Courtney, can I follow up with that answer real quick? What were some of your concerns as being a Black woman, and some of the things that you were hoping were acknowledged and were acknowledged? You said there was a list. I'm just wondering if you could offer a few of those things that are specific to maybe our culture. That is
sure. Just mainly the risk of death. That was a big one. Yeah, I didn't want to die. Like, statistically speaking, I'm absolutely more inclined to not be alive following delivery of my child because of racial disparities. Not really because I'm in horrible health, not really because my child was in horrible health, but simply because of disparities and other people's opinions and lack of good care that's not received, just care that's not received at a level that it should be received for women of color. So that was the main thing. And then risk of there being potentially some abnormalities with my child also because of that, because of disparities. Again, not because we were unhealthy, not because there was any other family risk factor or health factor other than those disparities.
Thank you. Thank you for elaborating on that a little bit more, clarifying for sure. Would any of the other panelists care to piggyback or join on this, on what Courtney just talked about? No.
I was going to say, I think a time that I felt safe walking into my doctor's office, I had a really bad experience with an OBGYN at State of Franklin Healthcare Associates. I will call them out. I had a bad experience there. And when I went into my new OBGYN, Dr. Crowder was amazing. I walked in and she was like, "What's going on?" And I'm telling her, and I was like, "And they're not going to give me a diagnosis, and I don't know what's going on." And she was like, "And this is what you've told them?" And she was like, "If this is what you need for closure and we can move forward, that's what we'll do." And so she just heard me talk and like moving forward. She was like, "Let's move forward." I didn't have to over explain myself. I didn't have to keep going. I didn't have to beg her to listen to me or give me something that I felt like I needed for my own health. And she walked in there and she's like, "Yeah, that's what we'll do. And we'll go forward and we'll keep that in mind." Yeah, and a part of my reasoning for not wanting kids is because of the health disparities. And at the old OBGYN, it was, "Oh, well, maybe one day you'll meet a man." But who's to say that I prefer men? That was an assumption that they had already made. And two, yeah, that was an assumption they had already made. And two, like, this is my health, and this is proving the point of why I don't want kids, because you're not hearing what I'm saying.
Right. So I'm hearing a common theme across this board of hearing, just listening is huge for safety, and that validation and that affirmation of who you are as a person in the room with them as well. That's what I'm hearing.
Yeah, I was going to piggyback off of that, Kaya.
Go ahead.
So my primary care physician, Dr. Partain, I'll say her name too because she's amazing. She's Cynthia Partain. She used to work for medical care and now she broke out with HMG, which I'm really glad she did that. However, she is very patient, and that was kind of what I fell in love with. I'm used to spending more time with nurses than I do the doctor. And I spent time with my doctor, and she got to know me as they were saying, she got to know me as a person, and she got to know me as a whole. She remembered me. I went like a year without seeing her just because I didn't need to. And she could remember exactly those same details about me a year later and was able to check in to see, was this still going on in your life? Is that still going on in your life? Hey, did you graduate? You know, these things. So she actually cared. And I remember once I went there and they weren't going to let me see her. And I was like, "Oh, well, I'll just wait. You know, like, it's not that important, because if I can't see Cynthia, what's the point?" When she had left medical care, I found her on Facebook. She wasn't like that creeped out doctor, like, "Why are you finding me?" Instead, she let me know exactly how to find her, when I could find her, when she'd be ready for any patients, and had me in the door as soon as those doors opened. So through telehealth, she's been amazing. So yeah, I think just taking the time to get to know us as individuals, because it's a lot easier to just check a bunch of boxes. And that's another thing. She's not in front of a computer screen. So when you're in her office, she's talking to you and you get that eye to eye contact. And that's very important. So yeah, toast to Dr. Partain.
Yes. I'm familiar with Dr. Partain. She works very closely with a lot of my trans clients. So she's bomb. I like Dr. Partain. She's good people. I like her quite a bit. Gracie, I wanted to give you a chance to respond if you had anything to answer before we moved on to the next.
I mean, I would just reiterate the same sentiments that everybody said. It's all about talking and acknowledging. I saw a host of pediatricians throughout my childhood, right? Because you have your one main doctor, but then that doctor is apparently never available for your checkup. So until I was like 17, I never had a consistent doctor in my practice. And then I started seeing Sarah Mullins at first choice, something like that. And when I came in, the first thing she said is, okay, I know you have this family history. She also sees my parents. So it's nice that I have that full circle. And she's an NP. And just hearing and saying, okay, you have these risks, you have the heart risk, you have risk with this because you're Black, and you have risk with this because you're Black. And it was very detailed. And now I see her every 6 months, and she's like, we're not going to let you die or get really sick. We're going to see you more often so that we can catch things if we need to, or we can check on these things. I do have hypothyroidism, and it's common in Black women. My mom, I actually got it from my mom's side, but it is common in Black women. And so she checks on that regularly. She's like, we don't need to let it get out of order, and we don't need to send you to the hospital where you may not get adequate care. So just, really checking on things and caring for others, I think, is what I would say.
Whew. Wow. Just even the ability to find a safe doctor and what you have to go through sometimes to make that type of connection. It's wow. That's wow. Same question, but let's take it to the place of reproductive. We kind of briefly touched on this already, but specifically with reproductive and sexual needs, health needs. What have been your experiences with just needing to take care of your sexual and reproductive health? And like I said, I know we've kind of breezed this, but I was kind of wanted to make that kind of specific. If there anything else that you wanted to add on to that?
I'll throw in when it came to Dr. Partain as well. We were having a general conversation about like, I'm in my 30s, I haven't had kids yet. I'm like, is something wrong with me? Like kind of deal. And I left there and like within 2 days, I had a phone call from like a fertility specialist, even though I didn't necessarily say, hey, this is something I need to know. She went ahead and went the extra mile and said, hey, if this is something you do want to know, here's like, I already found the one for your insurance that covers that. And like had me already set up and ready to go. So I think that was my only I haven't done much in sexual health or reproductive in Johnson City or this area. So I can't really speak to like how they treat others. In North Carolina, I got treated amazingly. But so I don't want to speak to the OBGYNs around here if I haven't met them.
That's very fair of you. That's very kind. Absolutely.
For reproductive health, I have a very high tolerance for pain, but something was wrong, and it took going to an ER doctor. Just randomly, I had been to the doctor probably for 3 months from October until January. Almost, I had been to the doctor because I had been on my menstrual cycle that entire time. It had not stopped. And I went to the OBGYN and they're like, oh, it'll be fine. It'll be okay. And things are still going on. And I just happened to go to the emergency room because the pain did get that bad. And she was like, I think there might be something going in. It was only by chance that my doctor's office had a cancellation to find out that I had appendicitis and a 10-pound cyst on my ovaries while they were operating on me for my emergency surgery. And so I have a history of a blood disorder. It's the thing that killed my father before I was born. It's the same thing that my grandmother has. And so, but we didn't know that. We had never been told that there was a blood disorder in our family. It only happened because an ER doctor was like, something's not right. Let's do a test. And my doctor's office happened to have a cancellation to find all of these reproductive things. So the appendicitis was one thing, but then as they're in there, they see this 10-pound cyst. While I'm in the operating room, I'm in the 9th grade. They don't come out and tell my mom what's happened. They don't tell her that they found something else while they're in there. It was supposed to be a 45-minute operation. 2 hours later, they come out and talk to her. Her husband died, not unsimilar to that. And so you can imagine her panic and my grandmother's panic as they're sitting there waiting to hear something. And coming out of that, I didn't get a clear answer of what I needed to do with my blood disorder and how that impacted my reproductive health. And so it took me a really long time to get that straightened out. And again, talking and no one's listening to like, hey, this is going on for me. And it just didn't matter.
One, I know we're having these discussions. The therapist in me wants to go, and I am so sorry. That was like, to be a ninth grader, to be 14 and have that type of situation happen. I can't imagine what you went through with that. And thank you for sharing how important it is. One, that, tell your doctors, like your children's doctors, what's going on with them. Oh my gosh. Wow. So let me ask this. What is one thing that you would like to see changed about your healthcare and anything regarding reproductive and sexual health that could be improved? What would you like to see changed?
So I think things that could change, I feel like providers need to take it upon themselves to be educated about what can happen specifically for women of color, the things that absolutely do happen. And I feel like some providers just aren't even aware of those risk factors that are a little bit innate for us, mainly because of just stereotyping and, oh, well, this little Black girl might be more promiscuous than another race. Just those assumptions that are often not the truth. They're just stereotypical assumptions that can be dangerous and damaging for healthcare for anyone, but particularly this group. So things I would like to change are just mandated education, because it's nothing that's mandated. Oh, we'll offer you this talk on this subject, or yes, we would like for you to go do this, but it's an option. You don't have to go do anything. And it's not safe for them to practice in those ways and to offer care to a particular group and not be aware of the things that can be going on that could happen and cause damage for their health, for their body. We are supposed to do no harm. We're not supposed to egg on what might already be going on in someone's body. And when there are already increased risk factors simply because of your skin color, you need to be aware of that. And you need to know, oh, well, I need to take that complaint a little bit more seriously. A few of us have already spoken to, fibroid disease, endometriosis, heart disease, diabetes, high blood pressure. These are all things just tick down the list. Someone in all of our families has it. They just do. And so when we're trying to do our best thing and be our best selves and stay as healthy as we can and are still ignored, it's not safe. It's not safe medicine. It's not safe for our bodies.
And I want to piggyback off this just because this question just came to mind. And for all four of you, how safe do you feel going into an office and saying, I mean, really anything, but just for example, I just had this situation happen. I don't know if I'm supposed to share a story, but I'm going to do it anyway because we're here. I had this situation where I recently had a pap smear. I haven't had pap smear in a long time. I had some trauma. So I was very clear in the forefront because that's just me now. I'm like, listen, I've had something happen. I need you to know that this is happening. And if you could just kind of walk me through it a little bit just to kind of ease it. It was met with respect. I was very, very surprised actually how respected I was in that, and still felt very nervous and hyper vigilant about can I even tell them this? Will this change this procedure? I don't know. So I just had that question pop up as Courtney was talking about, this word safety keeps coming up. Safety. And do you feel safe, or at least in this area, to go into your doctor's offices in the Northeast area and say, I've had something happen to me. could you like be gentle in this procedure? Could you be, you know, making them aware? I don't know. I'm curious.
I guess I personally feel safe to advocate for myself. And what you did is just advocacy. And that is, if that's my mountaintop sermon, that'll be my mountaintop sermon. I wish and I hope that people will open their mouths and do exactly what you did and advocate for yourself. If there's, you know, if you're over the age of 18, generally you're going to be in an exam room alone. There are exams that have to be chaperoned, so there should be someone else there with certain types of exams. But you should always talk to your provider and advocate for them, even if initially you're not feeling as safe in that environment. It is a little bit of your responsibility to speak up and to advocate for yourself so that you can have a little bit of control of a situation that may leave you initially feeling out of control. Take responsibility for your own feelings and the things that you know to be true for yourself, and let that person know that, hey, this is how this needs to happen. If we're gonna go proceed with whatever the procedure might be or whatever the exam might be, these are the things that I need you to be aware of, and these are the things that I would like to see happen in the midst of this process. So I would just say advocating for yourself. It's a must. It's something I see pediatric patients every day. I talk to my 3-year-olds about hey, tell mommy and daddy, tell them what's wrong, and be comfortable telling them these things, because that childhood trauma, sometimes it starts there. It's so unfortunate. It's so sad, but we need to teach everyone from an early age to just speak up and to advocate for themselves. And I do think that would maybe lessen some of that continued trauma that we might see, especially in medicine, for patients.
I mean, and as we're advocating for ourselves, especially as women of color and people of color in this area, that again, that they're listening, that they're adhering to what we're requesting as we advocate for ourselves. And I don't know how balanced that's been. I'm thankful that the experience I had was met with respect. And I know that's not everybody's experience. And so thank you, Courtney, for elaborating on that. Yeah, we do need to advocate for ourselves, and those listening hear us when we say we need, like, there's stuff going on that we're trying to advocate for ourselves. I want to leave that open. Does anybody else want to chime in with this topic before we move on to the next question? No. Y'all are so pretty. Okay. Let's see. All right. So let's talk about the negative experiences. So I saw someone, that's what I've been waiting for. No, we want to share the disparities that we've been experiencing. So the question is, have you ever had a negative experience seeking or receiving healthcare because of your gender, race, ethnicity, sexual orientation, age, or disability? Just all of it. Just, have you ever just had a negative experience based off of those things? The intersectionality of all of it.
I guess I can go first. So the story I'm telling is not mine, it's my dad's, but I lived it right beside of him. And it was a very long kind of story because it didn't just happen in 1 year, it happened over multiple years. So I even called him to get the dates right. So in 2017, I was in grad school. I was in a really hard program. It was a 1-year program. And my dad got sick. So he goes to the hospital and they diagnosed him with pneumonia. And once he's in the hospital, he quickly ends up in ICU and he's there for multiple days. My mom never leaves the ICU one day. They've been married for 40 years. So they've just never spent a day apart. So she's there every single day. When she can be in the room, she's in the room. And then when she's not, she's sleeping out in the little ICU hallway. And my brother and I go and check on her, bring her food and all those things that you're supposed to do as a kid. He's there for a while, weeks turn into months. And eventually they send him to Bristol, but not to Bristol Regional, up to the 7th floor. And we weren't quite sure because my parents are, they had really great insurance. We didn't understand all the moves, you know. We didn't understand why we were going to what they called a specialty hospital and all these different things. During the transport from one hospital to another, we're not sure when or how, a scar on my dad's back showed up about this long. There was no surgeries that were authorized, nothing, but he has the proof of a scar. But now he's in this new hospital and he's now deteriorating. No longer is he in ICU. He's just getting worse and worse. And now we live in Johnson City, so my mom's not going to drive back and forth. She stays. I'm still trying to figure out, do I stay in school? You know, my brother lives in Asheville at the time, so I'm here by myself. My older sister lives somewhere else as well. So it's the 3 of us. This time my parents are 70 years old about when this is all going on. My mom has like a speech impediment from the different times she's fallen, so it's really hard to understand her. So my dad's brother, who is 80 years old, comes in from Kentucky so that he can try to like help speak up for my dad, because you can see his baby brother like falling apart in his eyes. And I'm driving to Bristol every day that I can, you know, still working because I have to work through school, obviously. And I'm so fortunate for the social work department because they made a lot of allowances so that way I could still see my father. So very fortunate for that program. So fast forward to I get to the hospital and the doctors are making the decision that they're going to put a feeding tube in my dad. And this is something that I knew was against my dad's wishes. And I also knew that my mom would just want to do what was best for my dad, and what would keep him around longer, more so than what was best. And then my dad's brother, he really had no rights. So him and I knew what my dad wanted, but he had no say so. At this point in time in my dad's healthcare, I was the one my dad left power of attorney, and we discussed advanced directives. We knew all this. And I'm also fortunate for my program because they put me in a medical social work class that made us do this thing, that made us have these difficult conversations. So my dad had always said, you know, I don't want these extraordinary measures. You know, I've lived a good life. And so I would go to the hospital, I'd feed him because he would eat when I was there. So he didn't need feeding tubes. It didn't make sense. So when we refused the feeding tubes, they decided they would send him into a nursing home. And in this nursing home, they refused his medication and they wouldn't give it to him. And we would go and see him every day. And he'd say, Ashley, they're not giving me my medicine. And we were like, there's no way, but they would say they were. And then, so he begged to go back to Johnson City Medical Center. And this had to be a long 6-month process that all this happened. And so when he begged to go to Johnson City Medical Center, the ambulance showed up and instead of taking him back to the hospital, they brought him back to my mom's house and looked my mom and my brother in the face and told them that he had 48 hours to live, and proceeded to leave. Through God and health and his medication and all the things he needed, and his normal doctor's team, he was okay. We had way over 48 hours. But as you can imagine, this is probably one of the most traumatic days in my whole family's life because we thought we only had a couple days left with my dad. And so my dad goes to the hospital. I mean, my dad goes home, he goes see his regular doctor, he does physical therapy. Somebody has to come, we have to teach him how to walk again, all these things. But we do it in our own home at this point in time because we knew he needed his family to heal, but they were keeping us away from our father. So no longer did we allow that. So my dad's church would come and pray with him. These were things that he didn't get to have anymore, but he got all these things back. And they all meant a lot to him. And so in like 3 to 4 months, my dad was fully recovered just about from pneumonia, what he had first, like what we went to the hospital for. But when he went to his doctor's office, through all the treatments that he went through, he ended up finding out that he was going to be on dialysis for the rest of his life. And this was the biggest fear for him because he lost his best friend, and his best friend had been on dialysis, and to him, the two things correlated. So he wanted to get off of this. So we seek professionals and we ask for everything. And we go to UT Medical Center, and we're finally in the conversation of getting a kidney transplant. We're excited. We finally have hope. And we're going to all the checkpoints. This is a 2-day thing. You got to stay in Knoxville and all these wonderful things. And then the medical social worker calls us back And she said, "Sir, did you know you've had cancer for the last year? And it's in your charts that they found it in the hospital back in Bristol." By this time, he had made it to stage 3 cancer of non-lymphoma, something, I don't remember at this point. They sent him to get chemo and all the things. I happened to do a little research being a social worker. The man they sent him to happened to be like the biggest drug mule pain clinic guy out there. So I did some research and sent him on to a different cancer center. He did not have to do chemo. I think he did he didn't have to do radiation. He ended up doing chemo. And now my dad is cancer free, but he will be doing dialysis for the rest of his life. But the pneumonia never stopped. No, this is the last. My dad's a fighter. Okay. And in year 72, he got pneumonia again. And we have to go back to Johnson City Medical Center. And at this point in time, he does the dialysis 3 days a week, and they're giving it to him. And they know this about him, you know, he's a man who goes there often because of sickness. And so they know who he is, and they know his needs, and they know his pains and all this stuff. They know who he is. They give him this new medication that's supposed to help pneumonia. Next thing you know, my dad is strapped to a bed and hallucinating, and he doesn't know who any of us are. And the nurse looks at us and says, "There's studies that say African-American men on dialysis deteriorate on this medication," but yet they were giving it to my dad. So I begged them to stop giving it to my dad because it was a 12-day supply before they would stop. And they wouldn't stop it. But I knew somebody, and that person I knew was a doctor. And because I knew a doctor called the hospital and forced them to stop the medication. And within 48 hours, my dad was back to normal. But had that doctor not called, my dad would have been across the street at Woodridge. So I just thank God that my dad is back to himself. 3 days of dialysis a week. Looking forward to his vow renewal with his wife. So yeah, it ends up happy. But if we didn't know our rights, because my teachers sent me through the right classes at the right times, and we didn't have the right support systems, who knows how that story could have turned out.
I'm speechless. I don't know about y'all, but like, what a roller coaster. Like ups, downs, and the
Hope and
the uncertainties of, and not feeling supported by this people you're trusting to take care of your dad, like that. Oh my gosh.
Yeah, it was a year battle, but like, had my dad and I not started having those conversations early, and had I not been a social worker, there's no telling how that would have happened. Had I not known the certain things that I knew. Nobody tells you not only are you a power of attorney, but you also need to know the advance directives. You also need to know these other things. You can't just go against a doctor's order. So it was a hard time, but I was thankful to have a very strong, I'd say, my support system outside of the medical field.
Right. And to kind of, and I definitely want to give the rest of the panelists time to answer on your experience, if you had, and probably have had experiences while you're here to talk to us about it. I did have a question that came up that kind of correlates to what we're talking about. You know, Ashley, we're talking about advocating, and I know Courtney had talked about advocating. Brianda talked about advocating for yourself. We had a question that came up, and it says, if a patient may have experienced trauma or gaslighting and is reluctant to ask for needs to be met, what can healthcare providers do to help them feel safe? Some folks never have learned to advocate for themselves or have actively been taught to sit down and be still.
I think, well, I can speak for at least ETSU Pediatrics. At one point in time, I know something that they used to do, and I think as a healthcare, I thought it was awesome. They sent out new patients in their new patient screener work. They asked the ACEs in those questions, and that kind of at least opened the door to like seeing if you've experienced some of those harder things. And Kaya, you've been doing this a little longer, so if you want to like touch what the ACEs are, if anyone doesn't know, you can. But
yeah. ACEs, for any healthcare provider, if you don't know what it is, that may be watching, or if you don't know what that is at all, ACEs stands for Adverse Childhood Experiences. It's 10 questions. And honestly, if you score 1, it's enough. And in my experience, I've yet to have a person hit a 0. So most people have at least one adverse childhood experience, and it is a great assessment to utilize because it is only 10 questions. It is really quick. And like I said, if you see a 1 or 2 here and there, it'll help you maybe direct treatment or maybe ask more follow-up questions based off of what you see. Yes. So that's a great suggestion, Ashley, as far as the ACEs questionnaire. And I want to leave it open to to my other panelists to go ahead and ask, or answer the question about your negative experience or how to advocate for yourself, either or both. Go for it.
Yeah, I guess I can go. So to touch on the question, I would say, in this, anybody on here who is any sort of counselor, social worker, anything like that knows every year you have to have, I think for social work, it's 30 CEUs. So they're continuing education units, and you can find these ones that are really great on advocacy for Black women, advocacy for Black men, advocacy for Black children, racism, how to talk to those with traumatic experiences involving race. And a lot of them are newer because they're just now talking about it, which is a whole nother conversation, but they're on there. And I think it's very important to see those every year. And part of the reason that it's even required for therapists is because you never know everything. And if you get complacent in your job and you think you know everything, you're missing those marginalized groups, which is something that social work really works to fix. So that's kind of how I've seen it. And of course, I don't have to do the CEUs, but I do them. And so that be what I would say for that one, is to look at those. The NASW, and I forget it, the Black Social Work Association has a bunch of great ones going on right now that are live talks, kind of like this. And then I guess from my experience, the one that always stands out to me, when I was a senior in high school, I got tonsillitis. Now, I'm not really sure how you get tonsillitis, but I got it bad. So I didn't feel good on Sunday, and I thought I was having a heart attack because my heart raced and I couldn't breathe. And my mom was like, "Oh, you'll be okay." Like, thinking it was an anxiety attack, like, let's calm you down. And my throat hurt, and I was kind of fine enough to go to bed, but I went to the doctor the next morning, and my regular doctor, this is why I never go to the doctor unless my regular doctor is available also, was like, "Okay, we're gonna fit you into this urgent care doctor." She gave me an aspirin and sent me home, basically, and said, "You'll be okay. It's just a virus." And 3 days later, my throat was swelled up. I couldn't breathe. I couldn't drink. I couldn't eat. I couldn't sleep because I was terrified that if I went to sleep, I wouldn't be able to breathe in my sleep and then I would die. And I think it was on Thursday I saw my regular doctor. She was like, "Yeah, we'll fit you in." And my throat was so swollen that they had to give me codeine syrup. They gave me a bunch of other medications, 2 steroid shots in the butt, like all the works, almost had to go to the hospital, all because the doctor didn't take me seriously. And I think about that a lot when it comes to race, because it's like, if I had been a white 17-year-old that walked in and said my throat hurt, wouldn't you have done a strep test? Probably. Or took a closer look. Yeah. I'm still salty about it, if you can't tell.
Well, I wouldn't even call it salt. I would just say this is it deeply impacted you. Like that's what it is to be sent home, to be dismissed. We'll say that's what that was, is to be dismissed. And you're not wrong, Gracie. I mean, in how skin color does affect even when you come in, and how much the treatment is applied at times. Um, and I'm sorry that was that was an experience that you had, as far as not being seen, not being heard, and not being tended to when you really weren't feeling well, for sure. Brianda, I thought, did I see you trying to, I was
I
wondering.
was, I
Yeah,
was,
go for it.
I was just going to say, to add to that for the advocacy piece,
Mhm.
if you can, to have someone go with you, even if you're not a good advocate for yourself.
Mm.
That's one of the biggest things for me. I'm the family advocate. So anytime someone in the family goes to the hospital, I'm the one that's there. I mean, these are extended family. Like, I'm usually at the hospital because they know that I'm going to say something when they can't. So if you can find someone to go with you, or they have, or your patients or clients have support systems, invite them in. If they feel comfortable with them, invite them in. I'm going to barge my way in regardless. But for others who may not feel comfortable doing that, invite them in and have them have that conversation. My biggest regret was being in class when my uncle went to the hospital at Johnson City Medical Center. A story not unsimilar to Ashley's. He went in for pneumonia. He had stage 3 cancer. As they did a colonoscopy, they ripped something and he bled to death. And so, to this day, the advocacy piece, I go for very hard. And so my thing is take someone with you if you can, or invite their families or other members to come in. Because yeah, there are times that they've probably been gaslit, and there's generational trauma with that. And as a service provider, your responsibility is to look out for your patients and your clients. Whether or not you know or you don't know, ignorance of the law does not, keep you from it. So same thing with providing a service. Just because you don't know doesn't mean you don't have a responsibility to these people. So if you feel like you don't know something about someone, or an identity that they have has a health concern to it, you need to actively go out and look. It's a privilege for you all to hear this panel today, because some people don't get that. It's a privilege to hear it, but you can also actively go out and do things. Don't wait for these marginalized people to say, hey, we're hurting and you have to actively do something. You can't be complacent and sit and think, oh, well, if I know at least. You also need to talk to your friends. If you have a friend who is a doctor and you see them doing something that might not, you've got to quit worrying about that. You need to be able to speak up, not just to your patients and tell them they can come in and talk, but you also need to talk to your friends and other service providers that what you see them doing isn't helpful and is harming their patients and their clients. That's my soapbox.
Yes. I like your soapbox. You had a lot, but what a great idea. There is power in numbers, and I really like, why am I not thinking of that? Like, take a friend with me, take a buddy, take somebody who, if I'm afraid to talk for myself, hey, if I miss something, like, just, yeah, we need to talk about that. When that doctor comes back in, we need to say something about what just happened here. And I 100% like virtual high five you on that, Brianda. I think that is that is a great idea, for those who are, even with the way that question came in of like, have been taught to sit still and not say anything. I'm like, who else's experience has that been? Yeah, exactly. And it is that intergenerational trauma that relies of just like, you nod your head and you say yes, okay. Only now I feel like we're now being more, through panels, through more discussions, feeling more empowered to say those things that need to be said. So yes. Also, participants who are watching, please continue to send in your questions. That was a great question. Whoever sent that, it was sent anonymously, and thank you for that question, very much. And please continue to do that through the rest of this panel. So one of the next questions, I'm kind of skipping around a little bit, but is, what would you like for our next generation of healthcare providers to know about providing care to BIPOC persons? Let's start there.
It's your job to educate yourself. You know, there seems to be this current idea right now that bewilders my mind that Black people or people of color, BIPOC individuals are somehow dutied to teach others what is going on and the racism and the things in it. And it's not my job to tell you that you have all of these biases. It's your job to sit there and go, what biases do I have and how can I fix them? And that seems to be, you know, I feel like a common theme right now. And so I would say educating yourself, taking a class on diversity. It's a requirement in human services counseling and then also social work to take a cultural diversity class. And I think it should be a requirement for everybody in the medical field, so that you can learn culture, other people's ideas, etc. So I would say educating, looking at what people have to say when they do talk about it and things like this in places like this, and taking note of your own thoughts and perspectives. And I see this sometimes with clients. I have very few clients that are Black, but the few that I've had have all said the same thing, that anytime they go to the doctor, the first thing, if they're in pain, that their doctor says is, well, I don't give out opioids. So thinking about the things that you have in your head and reeling it in.
Good. Yes, go
I
ahead.
know. I'm like,
I know.
it's just, I know, it's insane. It's just insane to me. It's just, I mean, I'm sitting here and like trying to not let my chin fall on the ground at hearing your all's experiences and your family members' experiences. And it's just, it's insane to me. I did adult medicine for a few years, and these stories are uniquely yours and your family's, but they are so common, and it baffles my brain and it hurts my heart that here locally, and I mean, it is local, people of color are experiencing this across the board. So what does that tell us about a pocket maybe of our local providers? It hurts my brain. It hurts my heart. It's not how it's supposed to be. It's just not how it's supposed to be. But to go back and answer this question, what would I want new providers coming in, new providers in this next up and coming generation, and the ones now? Ultimately, I want them to know we don't trust you. We don't trust you. We walk in your door and we ourselves already have this cemented, ironclad, bricked up wall. And unfortunately for that provider, benefit of the doubt, it's going to take a whole lot from them to even begin to chisel away at some of that concrete that's there. And that speaks for me personally, and I'll say for family members and people that I'm aware of, you know, their medical ailments. There is such a lack of trust. And that is because of stories like these and what our family members have experienced, or what our neighborhood or community members have experienced. Because we are sometimes willing to share those stories in a safe space, but we don't often go outside of that safe space and share those stories. So then that builds up more lack of trust within our community. So I want providers to know we don't trust you. So please know that when we come through your door, there's already like our guard is all the way up for the most part. And you really need to do your best to bring that guard down and allow us to gain your trust, because it is going to be a big mutual respect there, a big gaining of rapport from patient to provider for that trust to be gained, so that our health can have overall better outcomes when that trust is gained. I mean, I have family members myself, and the same with what Brianda was speaking to. You know, I'm that person. Hey, so and so's got a doctor's appointment. All right, like what time can I be on FaceTime? You know, and I'm happy to do that. I'm absolutely happy to do that. Even just close friends, sometimes more in a pediatric realm, I'm the person they call, like, hey, this is going on with my kiddo. What should I ask about? What should I do? And I'm so happy to be that person. But for the people who don't have that person in their family, those are the people that I don't sleep thinking about sometimes. Like, those are the people it's like, well, gosh, you know, my family has me, my friends have me, just as your family and friends have you guys to help advocate for them. But what about Joe Blow down the street who knows nothing, who has nobody to speak up for them? So how can we help impact those people? I don't have the answer to that, but that's something that I would love to gain more knowledge about and figure out how to help that particular community that does not have that person who can advocate for them. And things, kind of going back to answer a previous question, things that person can do to, when they're maybe unwilling to speak or don't think that they can speak. I know we talked about like questions that can be answered and things that the provider can ask. Absolutely. And then being willing to maybe write it down, just writing down questions that you may have for your providers and making sure that you're getting those questions answered. I know probably lots of doctors or NPs or providers may see a patient walk in and we say the notebook. Oh gosh, this person has a notebook. I'm so thankful when people have a notebook, because that means they have specific things that they are asking of me and information that I can hopefully be as clear and concise on, and we can both stay on the same page. In my opinion, for me, I know that person's extra organized and they took the time to want to seek out specifics on whatever their healthcare thing may be. And they're asking of me to also provide them back those specifics. And so I love it when parents walk in with a notebook, because I'm like, yes, you're organized. So we're going to get this thing done. We're not going to be walking around bushes in our conversation. Like, let's hit it and let's be done with it. So just writing those things down and not being scared to try and address them with your provider.
Yeah, I almost forgot this, but thankfully my mom texted me. I'm 20 years old and my mom still texts me all the time when I forget things. So, you know. But a few years ago, so my brother and I are 7 years apart. My parents pretty much had me to the point of self-sufficiency, and then they decided to start all over again. I don't know what's wrong with them. And they had went to the doctor, and my brother has severe pulmonary issues. And he was probably, I don't know, maybe 7 before he actually got help for it anyway. From our pediatrician, was that whole experience was a wild ride in itself. But he had went to the doctor and they had a racist book. And the woman was like, oh no, it's okay that it's racist because my mom gave it to me. So it's not harmful. And it's like my dad, and if you ever see my dad, he's huge. He's 6'4", he's big and black. And so he really intimidates people. And they just kept arguing with him about how it wasn't racist because his mom gave it to, or her mom gave it to him, or whatever. And I think about that a lot. And then to go back, because my mom wanted me to tell the story because she thinks it's incredibly horrific. I went to the dermatologist 2 weeks ago because I have a cyst on my left side, and my regular doctor wanted me to get it checked out just to make sure like it wasn't cancer and, you know, nothing was wrong with it. And first of all, the doctor's office wasn't wearing masks, which made me very uncomfortable, even though I'm fully vaccinated because, you know, pandemic. And then went in, the lady's like, so you have implants, right? I don't have implants, I'm just well endowed. And proceeded to talk to me. And then the doctor came in, cut into it with an X, barely. Was like, yeah, there's nothing I can do. And let me go. Right, with 2 weeks worth of antibiotics. So I leave and I tell my mom, and I'm all mad, and my mom calls back because that's my mother. That's typically my advocate. And she's mad, she's on the phone. And the lady had a completely different story of telling her what happened. She was like, I asked her all these questions and she didn't say she had anything. And she said she was fine. And, I told her she could come back in 2 weeks if it didn't heal. My mom is like, whatever, because that's the experience that people have around here. So I just had to go back and share that.
So my tidbit to the question is advocacy is not aggression. I think a lot of times we all get labeled as aggressive, even when we're just speaking up for ourselves. So that's my biggest thing that I would like to add. And then another thing I wanted to add, because I've heard kind of a little theme between all of the panelists about pain and African Americans and pain. And that's another thing that I feel like is highly stigmatized about, like, oh, we all have really high pain tolerances, so we can all handle different things. So that way we either don't get the medication that we need when we are in pain. And I can just remember personally going to the hospital after an altercation with a partner. Clearly it was like a domestic violence situation. I'm walking in barefoot crying. I'm a very prideful woman. I don't cry in public. And then I'm holding my arm and they're just telling me it's a dislocated shoulder and to move along. And x-rayed me and everything and disregarded my x-rays, sent my x-rays to orthopedic surgeon, but it was too late. And by the time I went to go see the orthopedic surgeon, my collarbone was permanently broken. And so if I hadn't started crying in the middle of the hallway, and then I got told that like other more important patients needed my room. So they sat me in a hall crying, holding a shoulder, not knowing what was wrong with me, knowing I told them I heard a bone break. So just knowing we're all not the same. We all do experience everything at different levels, and just treating us each as individual patients. As like we all said, as different care providers, every different client that walks through my office, I'm not going to assume whether they've all experienced sexual abuse does not mean it was the same experience for them. And I'm going to treat them each individually. So very important to just treat us all as human, because we all are.
Mhm.
Ashley, I love that you pointed that out, because I have a high pain tolerance personally. That's not the case for everyone. Everyone doesn't have a high pain tolerance. So my tidbit for future generations is know the history of some of your medical practices. Know about Henrietta Lacks and the father of gynecology and how they come to know this information, because most of the time it was from experimenting on slaves and BIPOC people in general. And so it's important that you know that history and know about those things, that's not true for everyone. Our experiences are different. And even if I do have a high pain tolerance, if I come in and tell you I'm in pain, I more than likely am, because I haven't felt it until just now. So
Right.
take that.
Right. I had a panel, a panel question, but an anonymous question came up, and it was just a statement that says it starts like a start by believing type of situation, what we've been talking about, of just start by believing, like don't question. If somebody says that they've been assaulted, okay, you've been assaulted. Like, we're not going to, if you say I've had this experience before in healthcare, I'm going to believe you and not be like, oh, it's just no, we're going to start by believing. And I whoever sent that, I thank you for that, because it is very real. And the thing about it is that, even being a one of the only few therapists of color in this area, I mean, that, I know not just, social work, but therapists. I had a client come in and, she was looking for a Black therapist, and she said, my first experience, I'm sitting here trying to talk about trauma, and my therapist, who was a white woman with a biracial grandchild, started asking her questions about her hair during therapy. And I'm like, I mean, the first question, I was like, tell me you're lying. She goes, no, I can't make this up. I was like, I know you can't. And I'm so sorry, because that was her first step into therapy. And her therapist wanted to make it about her hair and her being her ethnicity and being Black. And there is work to be done in many different fields, not just healthcare, mental health care. Like, there is work to be done, definitely in those. And Ashley, like I absolutely thank you for bringing up how advocacy is not aggression, and how that label, especially as women, that label of the angry Black woman. I had this angry Black woman in here the other day, and she was just, oh, she was doing exactly like anybody else would. And like, I need answers. I have questions, and passionate about, what they're getting and receiving from their providers. So thank you, Ashley, for bringing that to the table. Thank you, Brianda, for following up. And Courtney, thank you for being honest to say, we don't trust you. I'll watch all of us go, thank you. Thank you for saying that. We don't. Like, that's valid. Like, we're walking in with hypervigilance, like, what do I need to be prepared for? What is somebody going to say? Type of situation. And Gracie, thank you for sharing. You've had so many experiences with poor interactions with healthcare providers, and your narrative is so invaluable. All four of your narratives are so invaluable. Like, I feel speechless, like at the same time, just like that happened, like that. Wow. It's just, ugh. And I really do feel like there's a question on here that was like people identifying as, or persons identifying with the LGBTQAI plus community, talking about, I'm very, very open about who I am. I am a Black queer woman. And so there's a lot of intersectionality there, as far as my experiences, one being a woman, one being Black, and one being gay. So being in the healthcare is a little bit different in that capacity too. And I like how Brianda said, it's like, you assume that I'm, I've got a man. And, my thing is like, are you planning on getting pregnant? I'm like, no, I've been married to my wife for 9 years. Like, no, we're good here. Like, and just that assumption. I'm curious though, when you're this question about persons identifying as LGBTQ, persons with disabilities or chronic illnesses, what would you like, just to touch on it, what would you think needs to be said to those coming up when attending to those individuals as well? I wonder if you had anything for that.
Something that we've recently implemented, and I see pediatric population, but something that, we kind of all as a group of providers got together and said, we know that we are seeing trans community in our practices, and we work especially close to endocrinologists who help transitional processes for our community. So we wanted to, up front, off the bat in our questionnaire, start asking just our patient pronouns and just giving them that space to provide us, what do you want to be called? What names are we calling you that you want to be called? And what pronouns do we need to speak to when we're doing our interview today? And just giving them that space to provide us that information, and hopefully help them be comfortable during their process when they're in our office.
Thank you. It's something so simple that makes such a huge impact. And that, I think I want to leave it open to other panelists, but just hearing that from you, Courtney, it's the small things. It's not these grand gestures. It's something that's this small, just like, what's your pronouns? And somebody go, oh, I'm safe here. Maybe relax a little bit, just a hair, just 1% more than what they were when they walked in, just because somebody asked them, what pronouns can I call you? That is huge, even in its smallest capacity, makes a large impact. And I want to leave that up to the other panelists, if y'all have anything to add to that question. For other marginalized groups of people, we'll just call it what it is.
Yeah, I think that definitely not having assumptions. There seems to be, I was still in my pediatric office, which explains a whole lot right in those words right there. I forget what age, I think it's 13, and this is probably, Courtney probably knows this more, but you get like your HPV shot, and it's like a 3-round series, something like 13. And the older I've gotten, the more, of course, now my doctor doesn't do it because I'm able to be honest with her, but they have this idea of promiscuity. And I got to hear the talk about how Black individuals are, what's the way they worded it? I forget how they worded it, but basically, if you're Black and you're having a lot of sex, you're going to end up with HPV, or you're going to end up with an STD of some sort, and which is its own thing. But especially when you're not straight and they assume, then they're like, just wear a condom so you don't get this, and take this shot so that when you're promiscuous, you'll be fine. And it's like, I'm good. I don't need that. I'm fine. I took my HPV shot because I believe in science and all of that. But I think it's really important to note that. And then in mental health care, I think it's important, to ask those questions. So I see somebody, I had to switch therapist because my beloved therapist switched to medical social work. And so now I see at LMFT, and one of the first things on their questionnaire is, your pronouns, your orientation. Oh, Kaya would know more because it's Journey, but all of these different things that help you and help the provider know more about you, so that there's not these experiences that are harmful.
We just got quite a long question from Juliana Williams. I want to read this to you all. Hello, everyone. I appreciate you sharing your stories for this panel. I am a white female counselor, and I completely understand when BIPOC folks seek a counselor of color. I also know that in a field that is predominantly made up of white women, there are not enough BIPOC counselors to work with all BIPOC clients. I am wondering if there's anything I can do that can help BIPOC folks feel more comfortable in considering whether or not to see me. For example, in my professional disclosure, I identify myself as an LGBTQAI+ affirmative counselor, something small to signal that I might be a safe option. I know that I still have to do the work to be competent and to earn trust, and I'm committed to doing so. Thoughts on that statement? Thoughts on that question?
Well, that's a great question, a great statement. And I think, Juliana, just what you've done is a big step, and just publicly letting people be aware that hopefully they can pick up on that cue that, yes, this is a safe space for me. And then I think probably word of mouth is going to be maybe a big jump for you. It's just the clients that you do see, they are going to tell other people, hey, if they're comfortable letting people know they're seeing a counselor, they're going to tell someone, and that word might spread around. But I do feel like in our tiny little pocket of a medical community, there's lots of just word of mouth, whether it be negative or whether it be positive. I know locally, sometimes I crack up these mommy groups I'm in. I'm like, those are the best way to figure out who's the good providers and who's the bad providers locally. But just hopefully good word of mouth advertisement for you from clients that are comfortable expressing their safety and their trust in you as a provider.
I was going to add, so if this is the Juliana Williams, I think it is. This is a classmate of mine. And I was going to say, Courtney, I'm glad you said word of mouth, because I was going to say, knowing who you are, Julie, I would easily, if you were my counselor, have word of mouth and say, Julie is this great person to go to. She's really going to listen to you. So if you really are putting in the work, people will know. Because I just had to brag on you just now. So word of mouth.
And word of mouth is huge in small communities like this. It is, you find a safe space. A safe space is a safe space is a safe space for most most part, not always, but word of mouth in like our tiny communities, even in these small collectives of, BIPOC individuals.
Mhm. And networking with those BIPOC individual counselors, just networking with them and yeah, and just learning together, share experiences, and that kind of opens that door. Because I know Kai and I have been talking, and we need to get together and talk eventually, but we're trying to collect this all together so we can try to start having more conversations about stigma and mental health. So yeah.
Right. And thank you, Ashley, for bringing that up. So if you're watching and you are in the School of Counseling or social work or, or healthcare, we are trying to build that collective in this area, hopefully sooner than later, and trying to have that word of mouth, knowing where those safe spaces are and how to reach our community of BIPOC individuals in this area, for sure. So I want to be mindful of the time. We have about 14 minutes left in our, Cindy just sent me a link thank you, Cindy. I'll make sure to mention it again. So with that, I would really just like to hear from you all individually, just as a wrap up of your experience, what you like. I know we've heard from all of you on things that you would like health providers to know. You've spoken about from your hearts about your own experiences within healthcare, and as we close tonight, I wonder if each of you could just take a couple minutes and just in your own way of wrapping up tonight and what you hope to see go forth. I'm a big proponent and be the change you want to see. So I know it's cheesy AF, but that's what I believe in too. So I wonder if you all could offer just a few closing statements each as we close this evening. And whoever wants to go first, you go right ahead.
I'll go.
Always awesome. I love it.
I'll try not to ramble. Let me get myself together here. So I'd say my biggest word, if we're going to leave with a word for me for this evening, is advocacy. And my second word, so 1 and 2, would be trust. You as a patient need to advocate for yourself on whatever level that you are able to do so, whether it's through someone else being with you or you yourself just acknowledging things that have taken place in your life and bringing those to your provider. And if that person's not willing to listen, then get the heck out of there. There's more people to see. If that means, getting in and digging into some online groups to try and figure out who those safe people are, they're here. Those groups are available to try and learn, like, what resources do I have to go to for myself. And then back to the advocacy, just please within yourself, speak up, speak up, speak up. Acknowledge the things that you initially are comfortable acknowledging so that the trust between you and your provider can be gained. Because we unfortunately are just at risk, I say, for all the things. We're at risk for all the things. Good Lord, I'm going to die tomorrow if it was up to my ancestors. Something's always going to be wrong with us. So it is a little bit of us to have that guard up, but also if we find someone that we trust and are willing to allow into our health space, to start to let that wall fall down so that your health can ultimately be optimum, and so that you can be the healthiest person that you can, physically, mentally, emotionally, and provide your best self to the world. And with knowledge for providers, I want everyone on here, if you don't know, and Brianda already spoke to it earlier, Henrietta Lacks, you need to be familiar with this woman and the contribution that she has made to medicine for the past however many years since what happened to her happened. The Tuskegee experiment, you need to familiarize yourself with. And those are just two major examples of why there's such a lack of trust. And I won't say that all or even many people of color know those stories, but a lot of us do. And it's something, I often say, and it's being done now in some medical schools. You are learning these things now in past like 2 years, whatever, it's too late. But it needs to be known what happened to us as a community over the past 400 years needs to be known. And those are two prime examples as to why it's going to take a lot of work on your behalf for someone like me coming into your office to trust you and to trust you to provide care for me.
Yes.
No, I was going to piggyback off of that if I can.
Yeah.
And I was going to say education, because that's exactly what she ended up with. Knowledge is power. And that goes on both sides of the spectrum for the patients and the providers. So patients, knowing your family history, knowing your medical history, knowing what comes to the table, and like knowing about Henrietta Lacks. I'm very fortunate that my school had me do a project and learn about genetics and all that. So yeah, knowing about your history is very important. And then as for providers, knowing about different cultures. We are all different, and see us, like, a lot of people try to say you don't see our skin tone, but yes, see us, because that is a part of who we are. So yeah, that would be my lesson. And I'm going to put advocacy is not aggression on a shirt. That's my trademark, everyone on this panel, so don't steal it.
I would definitely buy that shirt for sure. I would 100% like get on board with that shirt. You made that happen. Ashley, I'm in. I'll Venmo you tomorrow. All right.
I would say my lasting thoughts are repair, kind of going with Courtney, is that we don't trust you more than likely going in, but word of mouth and making sure that you are a culturally affirming person and a safe place and a brave place where someone can be vulnerable, challenge certain beliefs. We will be uncomfortable, but we need to know that we're safe. And so that's the main takeaway. So repair, you've got to repair those chips. It's going to take time. It won't happen overnight. And my second word would be empowerment. Empower your clients and your patients. And for the patients and clients, if you are someone else on this panel who identifies with a marginalized identity, empowerment. You are human and you deserve to be here. And we are going to be here until someone listens to you.
Yes. Right on, Miranda. I don't like it.
All right, I guess that means I'm last. I would say, I'm bad at words. Okay. Number one, for healthcare providers, mental health, physical health, check yourself before you wreck yourself. Check your biases. Not every Black woman that comes in is Medea, which also Medea was made to make fun of that stereotype. So check who you think you are, check the way you treat clients. If the first thing when a Black woman or a Black man comes into your office is whether they're just seeking something, you've got some things to work on. And for people of color, what I would say is, don't quit fighting for yourself. Switch doctors as many times as you need to. I always say, who cares if you fire a doctor? Because at the end of the day, do you want to be dead, or do you want to be that person that's like, oh, I'm just going to be okay and it'll be fine and I'll be okay? So those are, I guess, my turning points. And I will also Venmo you if you create a shirt, because I would wear that all the time.
I think you got some work to do there, Ashley. I think that's supposed to happen. We have Cindy and Juliana. Is it Juliana? She also ditto. Everybody's like, yes, they would buy the shirt. I think we need to trademark something.
I guess I better
Actually,
get a hold of our friend group, okay? Someone's gonna have to make this shirt for me.
Actually, you need to get to a printer tomorrow, because that's
Yes,
perfection.
That is
somebody. I really am. I've got friends.
Um,
I love it. Thank you. I love it.
Before we end our call, or this panel, I want to thank you all so much again. I honor you. The light in me sees and honors the light in you. The human in me sees and honors the human in you, and my skin. Like, we beautiful, we Black, we here, and we're doing big things. Y'all, I want y'all to look at this screen. This is like, including myself, we are 5 professionals out here doing our work in the community and doing it the best we can. Educated, well-spoken, well-versed, and through experiences have more knowledge. And so that's another thing is, you know, we're okay to have the conversation. Just ask the question. Like, let's have the dialogue. So continue to ask questions. I used to teach, and I'm like, there's no dumb questions. If you don't know, ask. Like, you don't know unless you ask. And so if you are asking the questions, just be mindful of how you present the question. That's all I'm going to say about that, because it is very imperative. And yes, and Cindy says we're also doing the work. And there's a lot of stuff out there that, you know, we can't do all by ourselves. We need help. We need the support. So again, if you would like, you know, what you saw here today, you want to be more involved in this conversation, what's happening, and how you can further this cause and helping BIPOC individuals in healthcare and in other ways, please go to www.risehfl.org. There is an event page where you can sign up for the workshop next Saturday at 6:30 p.m. to continue the work that we hopefully have kickstarted today. Oh, Cindy, thank you, Cindy. It's free. You don't have to pay for it. So there's no cost. It is just your time and your energy that is invaluable to helping us all as a community better ourselves. So thank you all again so much for your contribution to this conversation. We will be having another Rising Voices panel for Pride Month in June, where our panel will be full of beautiful LGBTQAI+ individuals to have another dialogue based off of their experience in healthcare. I think I'm moderating that one as well. Thank y'all for because my first time, and yay, we did it. Okay, so thank you all so much. I would love to keep in touch with all 4 of y'all. Let's get it together. Let's figure out how we can help. And thank you all again for joining in this evening for our first of hopefully many Rising Voices panels. And good night. Thank you so much. Okay.
Thank you.
All right. Thank y'all so much. Bye-bye. I'll see you soon.
Bye. I'm trying to figure out how to leave. All right, here we go. Bye.
There you go. There you are. Okay.